my name's Rebecca Kelly. I'm a clinical psychologist working in South London and Maudsley NHS Trust in a service called Pick Up, and we see people with psychosis and with bipolar for psychological therapies. I'm going to be talking a little bit about bipolar and how it's different to other forms of psychosis. So bipolar disorder, which has got a few different names, it's been called different things over the year, is a difficulty of mood, essentially. People experience real highs in their mood and real lows in their mood. The difference between this and other forms of psychosis is that tends to be the main problem that they're experiencing. So people with bipolar might well find that when their mood is very low or when their mood is very high, they might hear voices, they might believe things that they don't believe at other times, but those things tend to be things that only happen for them when their mood is at that extreme. And whereas people with psychosis might find that those beliefs are dependent on other factors really, rather than only really kind of at their worst when their mood is really high, when their mood is really low. In terms of one area that bipolar is really similar to how we would think of other experiences of psychosis, it's also something that exists on a bit of a sliding scale. So I would often be sharing with people that I work with and see for therapy that, lots of us experience ups and downs in our mood. It's really common for our mood to vary, for us to feel really, really excited at times and for us to feel really sad or really low in energy at other times. For some of us, our mood is really, really steady, and actually that's quite unusual to have really, really steady, predictable mood no matter what's happening to you. And for other people, their mood might be really responsive to situations in their life. They might find they get very, very excited in a way that's really hard to control and hard to limit, or their mood gets very low and it's hard to pull themselves out of that low. And it's that end of the extreme really that we might describe using that term of bipolar disorder. But actually a bit like psychosis really, bipolar disorder is one of these terms. It's kind of used to explain the idea of having highs and lows in mood. But the term we're using isn't the most important thing. So from a psychologist's point of view, we'd be thinking about if you're somebody who's experiencing ups and downs in your mood that are really bothering you, they're getting in the way of things you want to do, you're finding it hard to manage, it's impacting on your life in a negative way. Then whatever we call that, it might still be helpful to get some support with managing those moods and understanding those moods so that you're able to live your life the way that you want to.